Helen Ferns, you've got a wonderful long title, but the bottom line is that you're the head research nurse looking after a lot of people, and you are about to open what will be the biggest new drug development centre in the UK or in Europe or the world. Helen.
Well, the world, we hope, that's what our aspirations are. And it's not only a clinical trials unit, but it's a chemotherapy day service facility, which will be the biggest within the UK. We've also got the Christie Clinic within there, which is a new private patient initiative, which will hopefully make the trust some money that we can reinvest back in NHS services, and also a dedicated aseptic service for clinical trials. So we're going to have 5 isolators within the building, and 1 is a dedicated gene therapy isolator as well.
So this is a brand new unit about to hit the headlines, and it's within the Christie Hospital, which is within the Manchester Cancer Centre.
Yes, it's within the Manchester Cancer Research Centre, which is a collaboration of 4 organisations really. It's the Christie NHS Trust, it's Cancer Research UK and the University of Manchester. And what this whole aim is, you know, on one site we've got the whole facility for basic research, translational research, a clinical trials unit, and a chemotherapy, a treatment delivery service that covers the greatest population within the UK really. And the whole aim of this is that we can attract, you know, our academic and commercial partners to come and work with us in Manchester, so that we can, you know, offer the patients of the North West and the rest of the UK access to the newest drugs in development at this moment in time.
I mean, the Christie has always been the beacon of excellence in the North West, and you've always had a captive population, which a lot of other cancer centres around the UK would like to have, but don't have. You also have a terrific loyalty, as I recall from my days on the board of the Patterson Institute within the Manchester Cancer Centre. This must be tremendous for your patients, because there is an awful lot of frustration around patients not getting access to clinical trials, not getting access to new drugs.
Yes, and patients are more empowered now. They've got more information on the net, and we should, each patient should be offered a clinical trial. If they're not offered a clinical trial, they should be asking why not. That should be the standard, especially a phase 3 trial. But the whole aim of the unit is to do more of the early phase research, so patients who have come to their end of the treatment journey, who want to continue on with more experimental drugs, or combining those new drugs with the standard treatments that they have access to it. And I think if we can prevent patients from travelling, especially from the north of England down south to the big research units there, or across the Atlantic to America, it will improve the cancer journey really, because these patients who do travel abroad for early phase trials are at the end of their cancer journey, and if they can get that somewhere more local, well, it improves their experience. And the whole aim is to speed up recruitment to the early phase trials, so we can get the drugs to market as quick as possible, so then we can improve outcomes in the long term.
Sure. You can't do slick and clever phase 1 unit without the lab backup. So tell me what's there: pathology, molecular pathology, pharmacology?
All that's there, but that is all that is contained within the Patterson Institute for Cancer Research, which is a University of Manchester facility and is a core funded unit from Cancer Research UK. So, the whole early phase research is what will go on within the Withington site within Manchester. It is a collaboration between those organisations. One cannot do it without the other. And that's what is the key focus. We've got that on one site. We've got the scientists who work within the labs and are doing the basic research, who have, relationships with the clinical research nurses who are delivering and administrating the innovative treatments to patients. So, and seeing that both ends of the journey, it just gives, increased enthusiasm for the job you're doing, and everybody can see the end outcome and see what's happened before that drug gets to the patient.
And these new generations of drugs are targeted drugs, and to give a targeted drug to the right patient, their tumour has to have the right target. So presumably you have to do this on site.
Yes, and that's all done as that. And again, within the new building, we've got a clinical trials sample processing lab and increased facilities for storing all these samples. Really is taking us into this new age of biomarker research and personalised medicine. And it's giving the research is based within the Patterson Institute, access to those patients to get those samples and the storage facilities for it.
Another big strength of the Manchester Cancer Centre has, of course, been imaging. And imaging is also now being used much more often in selecting the right patients according to what characteristics their cancers have got. Presumably this is all part of the picture too.
It is, and on our centre as well we do have the availability of PET scanning and research related to that. We've got the WMIC, which is another institute within Manchester University, and that's on our Withington site as well. So we do have an increasing portfolio of radiology research related to PET.
Sure. I don't know too many centres who've got all of that in one place. Tell me, what's it physically like?
It's an iconic building. It's everybody who's seen it so far has looked at it. It's clad in brass. The environment is not like a hospital. It's not like a clinical area. We've had user involvement from the staff side and patient side within the design from early on is up till 3 years ago, and what we've wanted to make it feel like is not as clinical as other units we've had in the past, and making it feel more comfortable, more light, more engaging. And again, it's been designed around the patient journey. So at the moment is patients receive treatment in 3 separate areas within the site. We've combined these all in one area, so whether you're attending and having your treatment on a clinical trial or as a standard treatment, you have one patient journey. So we're hoping that the improved environment will improve care for patients, will improve their outcomes, but also it's a much nicer environment for staff to work in as well.
Sure. I mean, my experience is that if you separate the intensive new drugs unit from the daycare chemotherapy unit, the nurses have a problem. Because each group of nurses thinks the other lot have got a better job or a more interesting job or whatever, and with your system, presumably you can use the same pool of girls.
Exactly.
Or boys.
Well, we're going to share some core staff, but our research nurses all work disease specifically, and they kind of project manage the clinical trials. And what we're hoping that will happen in the future is, when a drug goes to license and goes into market, our chemotherapy team don't know anything about it, where our research team have been working with that drug for a number of years and know everything about it. So we're going to have shared education, shared support really, because we do know that patients on clinical trials do have better outcomes than those who are not on trials. So what the whole aim is that we pool our expertise and share that with the chemotherapy day services team as well, to bring us all up to one level.
And you mentioned that there will be a private sector component here, and that's Healthcare America, if I'm not mistaken.
It is. It's a joint venture between the Christie Hospital and Healthcare America. And the Christie component of this is the funds which are raised, the revenue which is made from this is enterprise will be reinvested back into NHS services.
I know Healthcare America from the States, and their clinical research and clinical trials activity is spectacular. It really is quite amazing. I think I interviewed one of their chief executives at ASCO this year, and they were making 109 presentations at ASCO from their research. So I think you've got good company. And
I think that's quite exciting as well, because I know it's something that myself and a lot of the research nurses who I work with feel that patients in the private sector do not get access or offered clinical trials, so hopefully we've already had some discussion with the chief operating officer of the unit within the Christie, and that's something that I'm very keen to introduce to them as well.
It's somewhat perverse that patients think they're getting better attention in the private sector and more opportunities, and in fact it's not that way at all.
It's not always that way at all. We do know within the NHS that you have clinicians who specialise in one disease area. We have treatment protocols that are followed. That's all evidence and research based, and that doesn't always happen in the private sector.
And then looking further afield, on the 1st of January, your institute, the Christie, and mine in Milan, joined with another 18 to form Eurocan Platform. Yeah. And this is going to be a terrific platform where we'll be sharing best practice across the top 20 cancer institutes in Europe. And you're up there. I'm looking forward very much to seeing even more results and talking with you again.
Thank you.
Thanks, Helen.
Thank you.